So we just wanted to thank the Franklinton Hunger Task Force for coming out today and letting us present to you. We are Fit for Franklinton, a nonprofit dealing with food insecurity and nutritional issues in the Franklinton neighborhood in Columbus. Other group members are passing out business cards right now.
Like Ryan said, the problem we're facing is food insecurity in Franklinton. And the definition of food insecurity would be to having access at all times to enough food to living a healthy, active lifestyle without having to rely on emergency food or relying on socially unacceptable ways such as bagging, stealing, or scavenging for food. Some things that attribute to food insecurity would be the size of a household, how many people you have living in one household, the accessibility to food resources, and most commonly would be the price of food. And the biggest question with food insecurity would be to not knowing where your next meal will be coming from. 10% of the U.S. population is affected by food insecurity. So the problem in Franklinton is that there's no grocery stores where citizens can buy produce and healthy foods. That is attributed by a decrease in population size. Over the last 30 years, Franklinton has decreased by an estimated 20,000 citizens. Obviously, the 10,000 citizens that are still there is not enough to run a grocery store successfully. Food insecurity can lead to many health issues, those being physical and psychological health issues, social disturbances, and poor eating habits such as eating junk food, frozen meals, and fast food meals.
So the problem of food insecurity and poor nutrition in Franklinton, or for Appalachian communities anywhere, is more prevalent than you would think. To find the statistics on this information, you have to look at food insecurity statistics for different populations that are rather poor, because there's not much information on Appalachian communities specifically. So in general, the amount of people in the state of Ohio alone who suffer from food insecurity make up 16.4% of the population of the state. And that is higher than the national average, which is around 10%, as Tanner said. And you don't even have to be around the poverty line level in order to need help with food insecurity, because the standard for receiving help is being an income level of 185% over the poverty line level. However, many issues can cause you to be in a food needing state, but not within that income level to receive help from the government, such as losing a job or gaining a new family member, or losing your food stamps, as many as you had before. And it is hard to get help from the government that the government does supply, because of, like in the form of food banks, for instance, because getting money from food banks, because it's hard for people to get to the various offices where they would need to apply for paperwork, or they don't have time to get off of work and do it. And so there can be many obstructions that are not foreseen in the government's attempts to give people help. This is a pie graph of the many other basic necessities that people are forced to choose between when they're deciding what they're going to spend their money on, food or other basic life essentials. And if you can't afford your rent or mortgage because you choose to spend your money on food, then you might lose your house. Or if you choose to spend it on the food instead of gas or transportation to work, you won't have a job. And so how are you supposed to make these types of decisions? And so you're either going to suffer in one major way or another. And this is a graph of the price that Ohio citizens pay each year for hunger-related issues. So the price of food insecurity does not stop with people who are directly affected by it. And charity costs for suffering in the workforce from lack of productivity or decreased productivity, and the healthcare costs of leading a food insecure lifestyle.
So specifically within Franklinton, there is an issue of income. If I'm a single working mother and I have 2 children, I'm probably going to use SNAP or EBT. Now this is regulated by the government. The cheapest meals possible are what the government deems necessary to buy. So like 80-20 ground chuck, chips. Nowhere is there really room to buy fresh, good produce to feed children. Another issue is transport. If I'm a disabled elderly person, I can't drive a car. There's only limited ways for me to be able to go to a grocery store, buy my fresh produce, and produce goes bad pretty quickly. I'd have to keep going every week. And there's not really a reliable way for me to do that. As far as education goes, seeing as EBT and SNAP only allows you to buy processed sodium foods, this is what my children are going to be learning, and it continues within the next generations. And as far as Franklinton goes, it is a food desert. This means within a 0.5 mile radius of any household, there isn't a way there is not a grocery store to buy fresh produce within the area. You have to go to places outside of your city that are far away to get fresh food.
So we have some recommendations that we found. Experts are raising awareness to the policy holders that they want to make more healthy food an option. Local food pantries and the emergency kitchens, various state initiatives are trying to improve to get healthier food for the people. And then another recommendation that we found was that physicians, nurses, dietitians, and all that should help address the food insecurity. And an example would be they could educate the patients on how to choose a nutrient rich diet at a cost efficient instead of the regular cakes, pops, and all that they get.
Okay, so continuing with the recommendations. First, we said that food should be considered a human right. So the UN, in their Declaration of Human Rights, actually says that it is a fundamental right, but the United States and Australia are the only 2 countries that don't recognize this. And we said ultimately this problem is a problem that has to be dealt with by policy. But the policy just isn't being made at the federal, state, or local level in the time being. So Central Ohio and every other region in the country, the charities mostly have to give Band-Aid solutions to fight food insecurity and hunger. They're doing a lot and they're doing about all they can, but the problem's still very prevalent. And we just wanted to talk about the one program that's put on by Fresh Foods Here, which is part of the United Way. They run this convenience store program that pretty much works with convenience stores to get healthier food in the stores so that people have better choices. So this map the orange part indicates that it's a food desert. This is Franklinton. So the orange part indicates that it's a food desert. These corner stores are the ones who participate in this program. So the green buffer is a half a mile. So as you can see, this program is attempting to reduce the size of the food desert, but as you can see, the impact is still limited. Continue.
So, in conclusion, what we would like the local government and community in Franklinton to try and do is do a community food systems approach in which food is more accessible to the community of Franklinton. With this approach, it can democratize and localize food so that it is accessible to all groups. Thank you all for being here today. It was an amazing experience, and I appreciate you for listening.
Several of you mentioned transportation as an issue, not just getting to food, but also getting to the accessibility of different benefits. I wondered if you looked into how to deal with transportation issues or talk to
There
people
are
that...
communities through Medicaid and Medicare if people are on it, but some people aren't. It's a little bit difficult to do that. I've also found some programs where there are people that have live-in nurses, and those nurses go out and buy food for people, but it's pretty few and far between from what I've seen.
Did you happen to run across the idea of mobile grocery stores? Oh. Okay.
I don't know, the literature, we didn't see anything
like that. Yeah, we didn't find anything within like what the articles we had been reading and within our research that had suggested anything about a mobile grocery store. So
Several communities have them, and it's a really interesting idea.
Does Franklinton have one, to your
No,
knowledge?
Not
Okay.
yet.
Well, that would make a lot of sense, though, because it would save the cost of a grocery store having to put up a whole new store in a certain area. You could just put money into taking it to them.
Is there any kind of community gardening initiative in Franklinton yet?
Yeah, there is the Franklinton Community Gardens. Yeah, there's the Franklinton Community Gardens, and Fresh Foods here, they kind of work with a number of the different nonprofits and charities in Franklinton, and the Community Gardens is one of the organizations they work with.
So people are willing to grow some of their own food?
Yeah, yeah.
This is just a memory question because I'm family from that part of the town. There used to be, is Hills Market on West Broad? I don't know if it went out, but I don't know if that counts as Franklinton or if that's more Hilltop. I don't know where that boundary is.
I think that's in the Hilltop.
Is that technically
Yeah.
Hilltop? Okay, and I think it closed, so that was closed, but it's gone now.
Yeah, it's not there anymore.
It's not there, that's what I thought, okay. I was checking my memory.
Yeah, all that's like along Broad Street from what I've seen, they have like a corner store tienda, but that's pretty much it. Everything else is just gas stations. So. And the Aldi's is all the way over on the other side on Mound Street, so people within that area can't.
Thank you.